A woman comes in for a routine MRI under sedation. She has followed every fasting instruction we gave her. By every standard we have used for the last 40 years, her stomach should be empty. It is not. And what we find inside it is rewriting 80 years of anesthesia practice in real time. Quick note before we get into it. What you're seeing on screen is an AI avatar, a digital version of me built from my own voice and my own likeness. The words are mine, the science has been thoroughly reviewed, and the cases are thoroughly researched. Because I'm a working anesthesiologist. My day job is in the operating room, not in front of a camera. This avatar is how I keep showing up here, between cases. Here is my commitment to you. I bring you the cases that shape the world we live in and the people we love, the ones that change how medicine is practiced, and the ones you need to know about before you or your family ever step into a hospital. So please like, subscribe, and enjoy. Now, back to the case. I'm Dr. Francois. Today we are talking about why one of the most popular drug classes in modern medicine, the GLP-1 family, the Ozempic family, the Wegovy and Mounjaro and Zepbound family, has the entire anesthesia community rewriting safety protocols we wrote in 1946. If you are on one of these medications, this video is for you. And if you are about to have any procedure that requires anesthesia, even a colonoscopy, even a wisdom tooth, even a cosmetic touch-up, there is information in the next 8 minutes that could change the conversation you have with your anesthesia team. But before we get to the modern case, I want to take you back to where the rule book started. Story time. The year is 1946. The place is New York Lying-in Hospital, at the time one of the busiest maternity hospitals in the United States. A young obstetrician named Curtis Mendelsohn sat down with the records of 44,000 pregnancies. He was looking for a pattern. What he found changed anesthesia forever. In 66 of those cases, women in labor had been put to sleep with ether, the standard at the time, and during the anesthetic, the contents of their stomachs had come up the esophagus and gone down into the lungs. Within hours, those women were cyanotic and their lips turning blue. They couldn't breathe. Their chest x-rays showed white patches in the lower lungs where the acid had burned the tissue. 2 of them died. Mendelsohn didn't stop at the chart review. He took the next step that we now consider the foundation of modern aspiration research. He poured stomach acid directly into the lungs of laboratory rabbits to figure out what was actually happening. And what he proved was that it wasn't food particles that were killing his patients. It was the acid, the pH. Anything below 2.5, which is the pH of a normal hungry stomach, and you got chemical burns inside the lungs themselves. Mendelsohn's paper was published in the American Journal of Obstetrics and Gynecology that year, and it gave us, in one document, 2 things that we still use today. The condition itself, Mendelsohn syndrome, and the rule that prevents it. Nothing by mouth before surgery. NPO, Latin for Oz. Every patient, every procedure, every time. That rule has been the bedrock of preoperative anesthesia for almost 80 years, and it just got broken. Let me show you what I mean. The case I opened this video with, the woman coming in for her MRI, she had followed every instruction we gave her. No food for 8 hours. Clear liquids stopped 2 hours ago. By Mendelsohn's rule, by every guideline I trained on, by every protocol on the wall of the pre-op holding area, her stomach should have been empty. So we put the ultrasound on her belly, just to be sure. And there it is, fits what we call the starry night pattern. Solid food. Hours and hours after she should have been empty. She started Ozempic a month ago. Last dose 7 days before her appointment. Not her primary care, not the radiologist, not the front desk staff, thought to ask. The class of drugs we call GLP-1 receptor agonists, Ozempic, Wegovy, Mounjaro, Zepbound, Rybelsus, they don't just suppress appetite. They slow your stomach way down. The technical term is delayed gastric emptying. The practical version? Your last meal can sit in your stomach hours, sometimes a full day, longer than it should. So when a patient on weekly semaglutide tells me she hasn't eaten since dinner the night before and has not been a full week since her last weekly dose of GLP-1 agonist, and the clock says she's been NPO for 16 hours, the rule that Mendelsohn wrote in 1946 says she's safe. The reality of her stomach in 2026 says she is not. When we put a patient to sleep, the protective reflexes that keep food out of the lungs, they shut off. Anything in the stomach can come up the wrong way. We call that aspiration. It's rare, but when it happens, it's catastrophic. Aspiration pneumonitis, days in the ICU, sometimes worse. Here's where the field stands as of this year. The American Society of Anesthesiologists has issued updated guidance and continues to refine it almost quarterly. The current advice for most patients on weekly GLP-1 injections is to hold the medication at least 7 days before elective surgery. For the daily oral form like Rybelsus, at least 1 full day. Some centers are now performing point-of-care gastric ultrasound on every GLP-1 patient before induction, No exceptions, no shortcuts. Some of the data is reassuring. Several large studies have suggested that for moderate sedation cases, eye surgery, simple endoscopies, the actual rate of aspiration in GLP-1 patients is much lower than we initially feared. Other studies have found stomachs full of solid food in patients who fasted by every traditional measure. The truth, as is often true in medicine, is messy. We are learning in real time with real patients on the table. And here is what I need you to take away from this. If you are on any GLP-1 medication for diabetes, for weight loss, for cardiovascular protection, for any reason at all, you tell your anesthesia team. Every single time. Every procedure, even a colonoscopy, even an oral surgery appointment for a wisdom tooth, even something that seems too small to matter. Bring the medication name, bring the dose, bring the date of your last injection. Here is what this story is really about when you strip away the pharmacology and the protocols. Curtis Mendelsohn, sitting at a desk in a New York hospital in 1946 with a stack of 44,000 patient charts and no computer to help him sort through them, that man saved lives he would never meet. Tens of millions of lives. People undergoing surgery on every continent in every decade since. Every one of them protected by a rule a single physician wrote down because he refused to let 66 tragedies disappear quietly into a chart. That is what medicine is at its best. One person notices a pattern. They write it down. They share it. And 80 years later, the people they will never know are walking out of operating rooms alive because of it. Now in 2026, the rule is being rewritten. The science is moving fast. The headlines are moving faster. And the only thing standing between you and a complication that nobody saw coming is whether the right information reaches you in the right language before you ever step into the pre-op holding area. That is the entire reason this channel exists. If this video gave you something you didn't have when you press play, a question you'll now ask, a medication you'll now mention, a story you'll now tell the people you love, that is the entire point of what we do here. If the information was valid, if it was useful, if it earned a few minutes of your time today, hit the subscribe button. Hit the like button. Send this video to the person in your life who is on Ozempic right now and doesn't know any of this. Every week on this channel, we walk through the medicine behind the headlines, the cases that shape modern care, the information that should have reached you sooner and now will. Subscribe so the next one finds you in time. The definition of fasting has changed, and we have to change with it. See you in the next case.